Hi guys, how you guys doing? This is Miss Lambert. This is a session that we're going to do in regards to the medical terminology. I'm going to go through a slide and let you know what's going to go on in this course and how you're going to proceed with this course. I do suggest that you guys read the slide. You can read the slide on your time. I'm just going to kind of go through with it and give you insight on medical terminology. You guys do have a file or several files in regard to medical terminology. You also have files relating to the tasks that I have given you. The tasks are 50 questions. You guys are to do a chapter, you do the task, and then it comes back to me. Okay, I will grade it and I'll forward it back to you. There is a list that you guys already have. It's pretty much your perimeter list where you can put your test scores on it. Okay, so if you don't have that, you guys let me know. So again, this is just kind of going through medical terminology and letting you know about medical terminology. But I do want you guys to go through the chat, even though you have this in a PDF. So I've already sent this to you in a file. I'm going to go ahead and share my screen and let me just show you guys what's in it. It's a little bit lengthy, so you guys do not have to do this at one time. You can do half hour, half hour, half hour, or XYZ. So let's go through it and see what you guys can get out of this chat that we're getting ready to do. Okay, so I'm going to just kind of move up to the beginning chat just so you guys can get an insight on what the medical terminology is going to consist of when you guys start doing it. Okay, and one of the things is medical terminology is a course that you do need, even if you guys are taking medical billing. I do want you to take this course because the billers need to know medical terminology as well. Okay, again, you guys know who I am. I'm Miss Lambert. Okay, I'm your educator for this course. Okay, welcome to medical terminology. This is your introduction to anatomy and physiology. When I say anatomy and physiology, I mean as in the body as a whole. Okay, this is where you're going to get your insight from. So this is a slide that kind of tells you a little bit about the history of medical terminology. Medical terminology often uses words created using prefixes and suffixes, Latin and ancient Greek terminology. So, I still want you guys to understand where medical terminology came from, what it was derived from, and this is also in your language of medicine book. So a lot of stuff that you're going to get out of the classroom is really a lot of reading and you guys trying to retain. That's why I always tell you guys to make sure you use index cards. The index cards help you to retain some of the information. It helps you to retain some of the definitions. It helps you to retain some coding codes, medical billing terms that may be on your CPB. So, and also your CPC. So this is the reason why we need to most definitely go through this. And here I'm talking about the index cards. The next slide is about index cards. So, the language of medicine book that you guys have, the book is included. I've already sent the book to you. Some of you who are starting medical billing and you do not have your medical billing books yet, you can start with medical terminology. I've already put the book in there. You read the chapter, you do the task. Read the chapter, do the task. I did put exercises with the book. If you want to, for extra credit, you can do that. It just gives you more insight of medical billing. Okay, and I suggest you, yes, you can do the exercises, but I'm looking for the task to come back to me. Every chapter you do in medical terminology should have a summary. I want a 200 summary on that chapter so I can know that you're clear on that chapter. Okay, and you'll get that back. You'll get that back. Okay, and that's what I'm looking for. I'm looking for you to have more clarity with medical terminology. So that's what the essay is about. Okay, so in the process of creating medical terminology, certain rules of language of medicine apply. These languages And these rules are part of the language of medicine mechanics. When we say language of medicine mechanics, just like any other language, Spanish, Italian, different type of languages, medical terminology is a language. Um, when you're working in the doctor field, even the surgeons, I mean, sometimes you have to be a surgeon to understand what they're really saying. So some of the stuff that's in medical terminology will help you in a hospital and also a medical office, okay? We're going to go through prefixes, root words. We're going to be putting words together. And a lot of that you're going to get out of your book. If those of you who cannot join into the live chat, let me know. I'll try to tweak something where you guys can get in on a one-on-one, but no worries, you guys can always archive the chats. Okay, and here we're talking about suffixes are categorized as either one, needing a combining form, two, not needing a combining form since they start with a vowel. Okay, decoding the medical field. Hold on, let me go back. Decoding the medical term is an important process. It's just like coding. When you have medical terminology, you need to know the definition of the medical terminology. There are glossary words at the end of that medical terminology book. Take heed to those words and take a look at those words because I want you to put those words on an index card so you can remember them. Okay, so this is your MT lesson one. Basically, it's almost the same as your PDF. It's just giving you insight about what's going to be in the course. Okay, in this section, you will find tests, exercises that are related to the systems, the body systems. So each one of those chapters will relate to a body system and it'll just give you insight on different parts of the body. Make sure that you look at those illustrations, the illustrations of the pictures, because sometimes on your CPC or your CPB, they ask you certain body parts. I know they do on CPC. On CPB, you may not get a question like that, but just be prepared. Some of you guys who are taking CPB, you may move on, to coding. Okay. So let's move on. Okay, this is just a quick reference. Some of the stuff that you're going to learn here, you can get it from any type of library. You can get it from Amazon, and I'm talking about different types of books, medicine books, law books, medical dictionary. I always use a medical dictionary, even though we still have the search engine. So when I say, you guys are in quick reference, that's what we're going to do. If you have a word that you're not sure on, go to your search engine and look it up. Look it up. I do that all the time. I mean, if I'm looking for something or I'm not sure about a meaning of a word, I'm just gonna look on and find it. I'm not gonna just keep going on. I gotta find out what the word means. Okay. Why do people use medical terminology instead of standard English? Medical terminology is much easier, quicker, and takes up less space than standard English does. For example, in documenting a patient's chart, medical terminology uses Latin because it is a dead language and will never change, which means the medical meanings will always be the same. And that's why the online book and some of the medical terminology books, I have a hard copy down here too. They're the same. The medical terminology lesson has the same words. This book does not change. The only thing that changes in this book is the year they make it, a couple of different upgrades. If more words are added, I mean, the words are not going to change. Okay, so let's just move on. And don't forget, you guys are going to read this. I want you to read this thoroughly when you go through this chat. Okay, where did medical terminology originate from? Okay, surprisingly, medical coding dates all the way back to 17th century Great Britain. There was a standardized system that was approved by the International Statistical Institute in 1893 and prepared by Jacqueline Bertillon. The AMA, American Medical Association, in 1966 invented the medical coding known as CPT codes. That's something good. So if you guys are moving on, put that on index card. It was developed as a standard for medical providers, hospitals, and insurance companies so they can identify what services have been provided. Okay. And I think that's good because that sounds like something I've either seen on a test or an exam or something. I would put that on the index card. Okay. Get your little box and all your index cards and put them in there so you can retain that medical billing information as well. Okay. So let's get started. It looks like something's missing up there. Let's get started. So one thing that I want you guys to know, medical terminology. It across the board, everybody needs to know medical terminology, whether it's billing or coding, because it's a part of revenue cycle. Revenue cycle is one, the registration clerk, all the way back to the coders. Okay. Everybody works as a team, but everybody knows medical terminology. You don't have to be an expert at medical terminology as far as your medical billing. Just be aware of some of the terms in medical terminology. The coders may have to go a little bit more in depth when it comes to medical terminology. They need to know what certain parts of the body is. Okay, so now that you know brief input about medical terminology, okay, this one has a lot of information regarding the medical language book, the medical terminology book. Now the book is called Language of Medicine, but I'm saying medical terminology book because it's medical terminology inside the book. When you do get it and you download the book, just take heed to the information in there, and you can download the book on your drive. So, I'm giving it to you in Google Docs so you can just kind of take it right off. This is just a course summary. The course summary is what's in there. It's 21 chapters in there. Yeah, we're doing 21 chapters. If you guys see the schedule, I'm going to do a different chat for the new schedule. So I don't want to go through the schedule now. I'm going to do a totally different chat. I'll shoot that out to you guys. In this case, the medical terminology, which has 21 chapters, you have an exam for each one of those chapters. I've already sent it to you in a file. It should say test, task, or something like that. You will get a competency at the end of your course. You need to get a 70. You guys know I always say I'll take an 80. Now that's because I want to just push you to do more. And don't forget, essay must be submitted for each section. This is just telling you about the medical terminology course. The medical terminology chat it's on Wednesdays. It's on Wednesdays. That chat is at 2 o'clock. It's from 2 to 4. On Sundays, that's when you need to be handing your task in. Okay, I'll have that back to you by Wednesday. Saturdays, that's your ICD-10 lecture. Okay, CPT lecture, HCPCS lectures. Okay, on that Wednesday, medical terminology and medical billing. Some of you have a schedule that kind of bump heads with that. It's okay because I can set a time and hour on a different time with you. That's if you choose to. You don't have to set one-on-one with me if you miss the chat. That's okay because you got to get the archive chat anyway. So if you miss it, it's all right. The purpose of it is I want you guys to be able to ask me questions. Ask questions about the chat. Ask questions about your homework. If that's something you didn't get a chance to do, we can do a discussion board. It's okay. You remember, discussion board is email, task, Instagram. However you guys get in touch with me, that's discussion board. I prefer Teams as the discussion board. I'm going to shoot out the Teams to some of the new students that we did get for this third session. And again, this is the third session. You guys will see this third session starts in September. Some of you started before September 3rd. That's okay. But, there are 3 sessions in Sapphire, okay? There's 1, 2, and 3, and those sessions always have dates. This session starts September 3rd, okay? So this is based on 20 weeks. Some of you will graduate before that. Some of you will take 25. That's fine. If you take longer than this schedule, all you're going to do is drop in on another week. That's it. No problem. Let me know. Okay. If you say, Miss Lambert, I didn't get a chance to get this test in, let me know. Okay. Let me know. And in your files, I believe in your orientation, I did go over where you're going to put those scores at. Okay. So again, here's my information. You guys know I always put my emails all through the chat. I put them in there to make sure you guys can get me. Because sometimes when you're in the chat, you got to text Miss Lambert real quick. Okay, text me real quick because you'll have that on your mind. But when we finish with this chat, you know what y'all gonna do. You ain't gonna remember what you wouldn't tell Miss Lambert. Because if you're sitting there and you're not bumping in and saying anything, that's not good. You got to tell me what you want. Tell me what, what's going on. But if you don't, you can shoot me a text at that time. Because I can see my phone blinking off, blinking. I'm sitting here doing the chat and blinking off, and none of you guys are saying anything. So you guys have to let me know. Nobody can see what you're typing there. Only I can see it. Okay, and then I'll respond to it. I mean, but you can text, that's fine. I'm okay with that. Okay, so let's kind of move on. So, okay, good. This is basic word structure. Your files do not look like this. This looks like this because it is in a PDF for me. Okay, but your first test will look like this. When I say test, I mean test, task, the same thing. Okay, and then the competency is the big test. This is pretty much a test. It's your test. But you see how it says gastrectomy. You're gonna choose one of these multiple choice answers and you're gonna put your answer here. Okay, that's basic word structure. And this is giving you an idea of some of what's on the test, some of what's on the exam. Osteitis. Okay, it's multiple choice. Okay, I'm just giving you an idea of some of the things that's on it. You guys got any questions? Let me know. Just pop in. Basically, it's multiple choice. And I put it out here like this so you guys can see thyroid gland, adrenal gland, ovary, mammary gland, and see how you'll see all these things because you never know. You might have this on one of your certification tests. Okay. You guys will get your completion certification here. I do not certify you students, but I do forward you to AAPC. You're going to take your exam there for CPB and CPC. Okay. Electroencephalogram. You know what gram is, so you know some type of X-ray or test or something, right? I'm not saying it's an X-ray of the brain or anything like that. Something like that. After you get through medical terminology, I'm telling you, you're going to be eating and sleeping this stuff. So let's move down. And this gives you a good idea what you're going to be looking at pertaining to the largest part of the brain. Okay, so you guys know right off the back that this, what I'm talking about is cephalic cerebral. That's related to the brain. Okay, so again, some people are good with taking multiple choice tests. I always mention my girlfriend, she's also with taking multiple choice tests, but just stick to the question. Just stick to the question. Sometimes you see stuff in here, and that pertains to look. It says pertaining to the pertaining to through the liver, cerebral, transdermal, transhepatic, subhepatic, hepatoma. When you're talking about medical terminology, you don't have any idea what that is until you read that chapter. So when you read your chapter, all this should be in there. If it's not in there, what are you going to do? Good. Your search engine. Your search engine or your medical terminology book. Because you wouldn't have any idea what these words were unless you read on it. You have to have the definitions of the words. Okay? Because I do the same thing. Incision of a bone. Okay? Your answer goes here. Your test will look different. I just put this here. Just keep in mind, see how they're talking about bone? Sarcoma. Pathogenic. Osteotomy. Osteotomy. Ectomy is cut. This one is cut open. Okay? Otomy, ectomy, endoscopy. Okay? Incision. I'm not giving away the answers, but I'm just putting you in the right place. I want you to do this yourself, but I'm just giving you an idea how they're talking about incision, right? We know what an incision is. You're just slicing or you're cutting something. Bone, so we know it's talking about the bone. Okay? Just kind of giving you a good idea of how you're going to do your work. But when you read the chapter, your answers are already in there. Just make sure you pay attention. And these tests have, they're 50 on each one, high blood pressure. So you guys all know hyper is high and hypo is low. Okay? Well, some of you, but when you go through it, you know that, okay? Use your search engine. I have definitions, I believe, at the end of medical terminology, but I'm not photographic. I look at it and look on the search engine too. I just know some of these things. Peri is what? Around, right? And look, oh man, this is a good one. I tell you guys all the time, things like this will be on the test. How to spell something. Membrane surrounding the heart. We know that all three of those are indicating surrounding the heart. what we're looking for is the right spelling. Okay, we're looking for the right spelling. Okay. What we're going to do is take those chapters, highlight what you want in those chapters. You don't have to use the electronic book. I don't know what I do with the book. You can purchase your own book. I think I got this one from Thrifts. I might have gotten this one from Thrifts for like $30, thrift.com. This book brand new, I think it's $145. And that's just because if you like to highlight and put stickies in pages and things like that, that's what I like to do. So you know, you don't have to buy a new book. You can use the ebook. Some people are not ebook savvy. Like I used to hate, you know, ebooks. I love ebooks now, but you know, I still, you know, I keep my books because I'm still a, you know, I'm still a book person. Okay. So again, ortho, select the correct meaning for each of the following combination forms. Ortho, bland, red, joint. So you want to stick to the question, stick to the question. Okay, you know that has nothing to do with it. You know where your glands are. You know what I'm saying? A joint is pertaining to, good. See, that's what I'm talking about. That's what I'm talking about. And yeah, you have to be medical terminology savvy. Um, when we start going through the lessons, this is the introduction. This is your introduction. When we start going through the lessons, you guys are getting more of an insight of what's on the test, because you have to pass those tests. If you're not passing those tests, I'll extend you more. I mean, again, you know, you guys can come to the course as much as you want to, but I want to see you guys do good on the test. But you see this heat pack, you can take index cards. You know what I'm going to do? This course is this is a coding course, and I just added in the medical billing. So if we go more depth and detailed in the coding, but I'm going to start doing the medical billing a little more. I see a lot of people are looking for the medical billing deeply and the CPC. So I've combined the two, but I'm going to give you guys more of what you need. Okay. So we know heat pad is what? Blood, kidney, liver. Which one of these is the heat pad? Good. Because I wanted to see, you know who gets this mixed up all the time between the blood and the kidney? I'm not giving away the answer, but that was the right answer. Okay, so renal, nose, kidney, liver. You know it's not one. It may not be the other one, but it could be pertaining to that one because that word and renal is in the same body. It's in the same set. It's in that same set. I'm not giving it away. I'm hitting at it. I'm hitting at it. Okay. So again, this is stuff that we're going to go through. I'm just going to kind of slide through these because Euro, you know what that is. I mean, this is a dead giveaway right here. But this is what you'll be looking at. You know, this is what pertaining to. And look, Graham, you know what that is. That has to be pertaining to some type of record of something going on. It's not these two. Okay. And this is a good thing. Stay in the loop. Um, one of my directors used to tell me a long time ago, stay in your lane, stay in your lane. Tell my students that they stay in their lane, stay in their lane, stay in your lane. Okay, when you see certain stuff and you know that's not it, stay in your lane. Scoping, they're looking in something, right? I'm not giving it away. I'm just showing you what is in there and what I'm going to be looking for. Okay, dia. These are short words. Some of these are suffixes and prefixes. This is like a prefix. It's a prefix because look, this is the beginning of the word and dash is right here. Okay. Your root word, you know, it's at the end. Sugar. So if you're new to medical terminology lesson, you guys know to what you'll be learning in this classroom. Okay. When we do the first lesson. Right now, we're just going through slides and we're just giving you an insight on what medical terminology is about. Okay. answers on the slides. I just put the slides here, so don't worry about where my answers are on this slide. You have PDFs that look like this. And some of you, if you want to print it out, you can print it out. Print it out, do the work, write it, scan it, send it back to me. Or you guys can even put the answers on paper, like paper we use in regular school, and send it back to me. However you want, just give me the answers and I'll give you the grade. But I still want you to take care of the test. I want you to put them in some type of folder. I keep hundreds of folders and all this kind of stuff. Put it in a folder so you can keep it, or put it in a notebook so you can keep it. Okay. So this is good. Let me show y'all this. When I be saying illustrations, this is what I'm talking about. I'm talking about stuff like this. I know this thing is backwards, but it is kind of little. But this is what I'm talking about when I be saying illustrations and stuff. I'm talking about pictures and things like that. Because you guys know I'm like picture prone. I love those illustrations in you. You're going to get to know them, I'm telling you. And some of you who are taking this class and you're taking your CPC, in the illustrations, make sure you write down some of the description, some of the anatomy of the illustrations so that you can get it when you're doing your CPC. Because sometimes they ask you, where is this? Where is that? You know what I'm saying? So especially your ear anatomy, write it down. Write it down. Now, you're not going to go crazy writing a whole bunch of stuff down like I do. Because when you go take your CPC, they're going to be looking through your book. If you got too much stuff written in there, they're not going to accept that book. So just be careful of that. Okay. Okay, so let's move on. I usually like have different books and put them up, but I know this is a long slide. I don't want to keep you guys too long. But remember, this medical terminology introductory class, this is what's going on. This is a whole new session. This is the third session. So this is what you guys are getting, all new archives. Some of the archives I do put on YouTube, but they're not for the class, they're for YouTube. Okay, master parts of the body with their correct descriptions. And I'm just giving you a description of, see these words: pharynx, larynx, cartilage, adipose tissue, pleura, trachea, urethra. Watch this one. You see that? Urethra and urethra? What is that a part of? Mm-hmm. Right. The URs are their giveaways, like your urinary system, but just be careful, because just like I was talking about the anatomy of certain body system, urethra, pay attention. I ain't giving it away because then I'll be giving you answers in the classroom. I want the rest of that. I want the rest of that. It's further down in the course, and you can give me that in your essay. That's fine. You can give me that in your essay. Okay. The larynx and the pharynx, watch that. That's different. And you need to know where they at. Cartilage. What's that? That's what I'm talking about. When you do your summary, you can do it on whatever you want. Just stick to this chapter. This chapter 1, basic word structure. When you do your summary 200, stick to whatever you know in here, okay? Study, read the chapters, and answer the test. Okay, collection of fat cells, windpipe. What's your windpipe? That's like an old school word for grandma and grandpa. They use your windpipe. It's just another word for it, okay? No, I'll see it on your chest. I'll know if you know it or not. Okay, 2 from the urinary bladder outside the body. That's these answers right here. I just got that right there. Okay, match the meanings with their correct terms. I thought this was cute. That's why I put it right there. Okay, so see next slide for terms. These are the terms that you're going to use to put in there. On your test, you're going to see this. And then when you get to the next page or below, you put your answers in there, okay? Everything is multiple choice, so you don't have anything to worry about. Everything is multiple choice. Now, those of you who are doing the coding, when you get to your procedures, I do have some long coding procedures. There's still multiple choice, but you still have to take your time. When you guys are taking your tests, and there's a lot of medical terminology in there. That's why I want you to study medical terminology to the core. When you get in there, you're going to swing through those procedure codes, because you're going to know what part of the body the doctor did the surgery on, what part of the body this, how long he took. Because certain parts of the body, you can't keep them open too long. Anyway, I told y'all, coding is almost like being the surgeon yourself. You have to decipher what he's doing. Okay. The billers, you guys have to put the billing out there, charge entry is now falling under coding. So they have to be CPC certified. But charge entry used to just be, the medical billers, but that's still considered, medical billing to me. But they're calling it coding. I mean, basically, the billers used to, they get the charge slip. Next chat, I'm gonna have a charge slip. They get your charge slips and they give it to the biller, and she puts the charges in. But now they are saying that she needs to be certified, which she's not the one reviewing the codes. I mean, she's passing this to the coders. So, I don't make the rules. My girls are all over the place, but that's the rules. Okay. So okay, so let's move on. So this is pretty much almost the same as what we're looking at. Not the same information, just the grids. Okay, muscle dividing the thoracic and abdominal cavity, lying on one's belly, structure in a cell where food is burned to produce energy. We're all trying to get that done properly. I'm telling you. I'm telling you, we're all trying to get that done. So some of you guys who are, I guess, like my age, who are taking a class, you know what I'm talking about. When you get older, it all just slows right on down. Okay, so put the correct answer in. Anabolism, okay, diaphragm, vertebrae. Any of you guys know what some of this stuff is? You can tell where this is at, where it's leading to, right? I don't mind you guys saying when we do the classroom, just that I don't want you guys to give away any answers when you guys are doing your work, okay? Pronunciation. Pronunciations and medical terminology is like foreign language. Uh, give the accented syllable in the following terms. We're going to go over that in class because everybody used to have a problem with this as far as give the accented. Let me see. When I say tomato, you say tomato. You see that? That's what I'm talking about. We're going to go over that a little bit more, but the accented is something people have a lot of problem with as far as the words. Terms for example here, anemia diagnosis, no endocrine. You see that? You have to have that medical terminology know-how to even decipher that. So let's move on. Put that one on the index card because we're going to go back over this. And this is in your chapter 1. Thoracotomy. This is here for the accented. Thor, A, cot, Y as an E, which is the accented. Okay. Cranial. What do you think the accented is in the cranial? Okay. I'll take that. You guys kind of getting familiar with the accented, when I say accented, cranial, cranial. They're asking you which one is more or less the accented. If I say knee is Knee, right? They're spelling it in I. It's accented as in I. It sounds like me quick. Viscera. What's the viscera? That's an easy accented right there. Sarah, Cer. Look at your book. I can't give you the answers. I'm going by what I'm listening to. Okay. I want you to read the book so that you can learn that. Okay. But when we do that first lesson, you guys will see that in there. And when we continue on, I want you guys to just make sure that you read, because that deciphering portion is very important. Either way, MB, MIB, or CPC. The control center of the cell-containing chromosomes that's a question to an answer. Okay, I just put that there just so you guys can see it. And this is awesome because this is just letting you guys see some of the stuff that you guys are going to get in this classroom. And again, this is the kind of stuff you're going to get in medical terminology. Now, you could slow this down anytime you want to. I'm just kind of going through, but just say you want to look at this, you want to look at it, without looking in the files. Some of you may not have the file yet. Some of you may, have not downloaded it in your computer yet, but it's okay. Okay. Just make sure that you understand this video, because some of you are looking at the video first before you open your files. That's fine. I will look at the video first too, because it gives you insight of what's going to go on in that classroom. So spine and dorsal. What does that mean? What does that pertain to? How you're sitting, back, front. Select the terms after spell. We just went over this, so make sure, you're going to see this probably in every chapter, and some of this is like, you can see what's right and what's wrong, but if you're not sure, um I don't mind you using your books. You can use your books when you guys are testing. I don't have a problem with that. But some of you don't need to go back and use the book when you guys are testing. Don't use the book. There's so much stuff in the medical terminology. Even if you use your book, watch how difficult it is. So that's why I don't mind if you guys, I don't mind if you use your book. But if you're doing the exercises for medical terminology, you're going to need your book anyway. That's a lot of work in there. When you look in your file, you will see the medical terminology book. And then I put a file in there, I think it's called exercises. And all I did was I split it. I split the exercises from the reading. Okay. Don't try to print it out. It's hundreds and hundreds of pages. Okay, and don't print the book out. It's hundreds and hundreds of pages. But wait till you see that medical terminology book. I'm telling you, I look at that book and go, there's some pages in there that are wicked. So, and it'll teach you a lot about medical terminology, surgeries, and different things. So I did listen this. Okay. I listened this to 200 because it took me forever to read it. I don't want you guys to be carried away, writing. I have students now, I'm telling you, they are gone. And don't get me wrong, y'all, I love y'all when y'all are gone. That lets me know that you're doing what you're supposed to do. Okay. Just, give me a call. Here's my email. Here's my phone number. I don't see they got that in there with the wrong number. Okay. You can use Gmail. A lot of you guys like to use Gmail. That's fine. I'm all right with that. I have several emails. So, if you want to use Gmail, that's fine. And again, we're just kind of jumping through. This is medical terminology. This is your suffixes. This is lesson 3. You remember there are 21 or 22 lessons in medical terminology. I know medical terminology is long. The more you do it, the better. Okay, and again, just keep your mind on the suffixes. Keep your mind on the suffixes. Remember, we did the prefixes and the dash was in the back, right? You know this is not the root word because this is dash right here, right? And then the word, the dash and then the word, pathy, ptosis, trophy, plastic, plasm. I love this one because these are so easy. These are easy. You guys are going to get this quickly. What is ptosis? Trophy, pathy. When you put a word in front of that, you know it's going to be pertaining to that. What is prolapse? Some of y'all worked in a hospital or nursing home. Sometimes you have elderly women. Sometimes the uterus prolapses or the bladder prolapses. It falls. It's juice. Okay. I've seen one patient where I think it was just so low. It's just, like it's just falling out. So I think, I know a lot of people had, had the hysterectomy and stuff to prevent, things like that. Okay. But again, death. And death is gas. If they're talking about death, you know what neuro is. You know what nephro is. Kidney. What's nephro? Neutral. Nuclear. It's a question on that that'll blow your mind. Pay attention. Nephro. Nephro is necrosis. Necrosis is dead tissue. Like something is necrosis when you see like you have that like a frostbite and it turns black. Necrosis, like your feet get frostbite and they turn black. Necrosis. You're dead skin. You know. I told you guys are gonna have fun with this erythrocyte, leukocyte. I even just like the definitions in there, even though you guys are picking them. I can't even pronounce just for isoencephal. You guys go ahead and pronounce that. Just make sure you get it right. But we know that it's pertaining to what? All this is pertaining to blood cells. right? You see white, you see the red there, you know what's going on in there. But again, this is what you're going to learn in medical terminology. This is what you're going to learn. So, the online school for Sapphire physician coding, it's the medical terminology is one of the most invasive because it's across the board. And trust me, all of your courses, you guys have a lot of things to do. Your coding, you have 18 chapters for coding. You have your step-by-step book. The step-by-step book, you must know medical terminology with that. The step-by-step book is your coding book. Those are the chapters that you are going to be doing combined with your CPC. That's why I have to have you guys get the CPC guide because you are taking their test. AAPC exam you are taking. So we have to go over that CPC guide. You guys are not up to that yet. That is down the line with the more advanced when you are finished with your pre-courses, your prereq courses. That's medical terminology, medical billing, ICD-10 and CPT. Your first ICD-10 and CPT courses are your introduction to ICD-10, your introduction to CPT. That's where I tell you all about CPT. We talk about ICD-10. Show me this, and that. I'm going to tell you what this is for, that's for, this is what that's for. Read the ICD guidelines 10 times. That might be enough for you to pass it. Okay. Because you're going to have to. I want you to read that thing like it's second nature. All your guidelines in your CPT, read it like it's second nature. Okay, let's go on. You guys know I'll be gone when I'm just steady talking. Select the term that is spelled correctly. That's the opposite from what you guys just see. I just want to kind of throw in. Do not hesitate to email me. I am like totally email person. I talk. You guys know, you guys call me and I talk. You guys send me an email. Let me know who you are so I can prepare for the call. If we're gonna do teams, we can do the teams one-on-one. And you guys know me, that's how I do. If some of you can't get in on the live chat, it's no problem. The live chat is for me to make sure that you ask questions about what you want. You might have a book question, you might have a Google Doc question, you might have a medical terminology question, CPT question, or whatever, a HEMA question or AAPC question. Which test is this? Which test is that? What do I need for this? You guys know with this course, you need a lot of books. I'm exaggerating. Some people do say a lot of books. If you get them in ebooks, it doesn't seem like that much. But that's why I want you to buy your books as you do the course. You do medical terminology first. That gives you time to get your course books. Okay. So by the time you finish with medical terminology, it's okay. You can go ahead and do medical billing. Okay. In your course, it says medical billing and medical terminology. Those two courses intertwine. You have to do medical terminology with medical billing anyway. So there's no getting around that. Okay. But I do that so that you can have time to get your books. Okay. Your medical terminology book, you have your medical billing book. Look in your file. It is there. The name of the book that you have to get is there. Okay. It's two of them, your workbook and then your regular handbook. I want you to get your workbook because I want you to do some of those workbook exercises in there. Okay, metastasis, beyond control, spread of cancerous tumor. We say metastasize. When you look in your ICD-10 book, you'll see it in there, and it's under cancerous, metastasize, or metastasis. Same thing, is the area where the cancer or the tumor has metastasized, spread of a cancerous tumor. It's metastasizing. It's multiplying. Okay, so you guys are going to read on that. Is it up on that too? So you see things that we're going to be talking about. How interesting is it? I mean, you guys can stop and tell me how interesting it is. If some of you don't want to type, that's fine. Send me a text and tell me how you feel about the medical terminology class right now. Tell me, what you're looking at. How do you feel about it pertaining to the voice box? Laryngeal, you know what it is. You have to choose one. Tell me how you feel about what you are looking at right now, because that's what I want to see. Hernia of the urinary bladder, sister still. This is, you gotta tell me which one's the right one. And those taking that CPC, you better make sure you choose the right one. I'm telling you, make sure you choose the right one. Tell me what you got, what you guys have on your mind. Okay. Select the correct meaning for each of the following suffixes. I love these little designs that's on here. This is blood condition, softening, breakdown, destruction, separation. You could just what how I do, I single out what I know it's not. I single out what I know it's not. You're just starting medical terminology. You don't know what it is. I'm not going to say what it is, but lysis is a new form. Lysis is something that starts from something else. Okay, something that's good turns into something bad. Okay, I'm not going to give you the answer, but just keep in mind, focus on the question. Focus on the question. Okay, process of recording to view disease condition. Oh, you do. Okay, 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 and that's good. That's good. This is a good one too. What do you guys think about this one? Pnea, pnea, pain enlargement deficiency. Pnea. Some of you already been in medical terminology. What are you getting? You know, from this. What are you getting from this? What is it? What do you think it is? Pain. Okay, okay. So you didn't forget everything, you know. And y'all can't give me a wrong answer. I mean, because it could be any answer. So, kudos to you, you know. That's what I'm talking about. That's what I want to see. Don't be afraid. Just say it. If it's, even if it was wrong or right, I wouldn't say it. But I would, you know whether it's wrong or right. Okay. It's pain. Yeah. So this is just a design showing you, how it is. Now, I have put in here. Um, I used to have a bubble test. I don't know what happened to the bubble test, but my Mac sync crashed, so I wasn't able to get a lot of my stuff out of there. What you guys haven't actually new stuff. I do have an answer sheet in here already. There's an answer sheet for your exercises that's already in here. Okay, I've already pre-did it for you. All you need to do is print it out. All of your tests have pre-exercise on them. If you go through any of your files, and this is you, what Miss Lambert got in this file, that's a call. That's a call. When you call me, make sure you have the paper that you want to talk about. Okay. That's okay. So look at the office hours. Okay. And the office hours is something that I have to put in stone. Okay, that's business purposes. But you guys can get at me anytime. And those of you who already kind of know my routine, know I'm an early bird. I do not hang out all night. So do not send me no email at 10 o'clock thinking I'm gonna answer. Okay. You send me a text or email after 8:30. Now I'm gonna answer it the next day. Okay. Pia, Pania. We know we just went through Pania, phobia, plasia. Pia is what? That's out of sheer, you know, that we know it's a suffix because it's got that dash in front of it, right? Mm-hmm. Good phobia. See, that's what I'm saying. You guys know some of it anyway, but can you imagine you having 22 chapters of medical terminology and you think this is it? No, this class is very long, and I don't do lectures every day. I mean, you guys get 2 lectures a week, and just be prepared for that. But watch, make sure you guys watch my Instagram because I always throw stuff out there. Okay, that's pertaining to your class more than likely. Okay, others are doing treatment, therapy, trophy, pathy. You know what this is because you know what it will pertain to. Good, good, good. Okay, excision. We talked about this one. This one I'm not going to do. It's just too easy. Okay, so I'm not going to go through all of them, but again, answer where here's fallen and drooping and prolapse again, surgical repair, nourishment, development, fear, blood condition, formation, disease condition, deficiency. I'm just skipping through. I just put this here so you can do your answers. But again, the answers are not, don't answer this. This is just for your chat. You have this already. Okay. If you have any problem opening that drive, let me know. Because I told you guys, you remember before, we used to have the other, I don't know why this is down here like this. we used to have the other course, and they were kind of limiting us. It was like a third party that we were using for the school, but we've learned to work around that, and now we don't have anybody controlling what you guys are doing, controlling when you guys are, and you guys know that drives me crazy. I don't like that controlling thing. I want you guys to be able to get what you need to get when you get ready to get it. So that's why we moved to the Google Drive. I've always done Zoom, but I use Teams at work. So I'm starting to bring Teams into the Sapphire. So I don't want anybody controlling when you guys are going to do what you need to do when you're submitting work. It just didn't make any sense. So that's why we tweaked the program. So, you guys know how I do. It's a program made by students for students. So I make it easy for you guys. It's challenging, but it's still doable. Again, hypertrophy. You're just going to pick the right answer. That's all. The process, just going to pick the right answer. We talked about that a little while ago. My contact information, you guys know, always put that there for you guys to get in touch with me. Again, just send me an email. You guys can send me a text. The 516 number, that's my personal number. You guys can call me on that. I'm okay with that. I don't know it's one of you guys because I have asterisk by you guys' name. But generally the 860 number, you guys call me on that. That's the Sapphire phone. You guys go ahead and call me on that number. Again, if you guys have any questions about what we just went over as far as medical terminology, just let me know. You're going to read your chapter and you do your task. You can print out the task if you want to. That's okay. I'm okay with that. What you're going to use is your ebook. If you choose to buy the book, that's fine. But again, the ebook is a way for you to have time to get your other books. We are working on, my son and I are working on something so that we might be able to get ebooks for all the books and give those to you. I'm not sure if that can be done. I have the rights to the ebook that I'm sending you, so I don't know if I'll have to gain the rights to the other ebooks if I get them and I have to, distribute them to you. I don't know how that goes, so that's why I don't do those. I have the right to this one from many years ago when I was a teacher in North Carolina. So the other books, that's why you guys are buying them. I know they're expensive, so we're working on that. There's always different type of chores, different things to do, different things to come up with. I mean, we might work on some grants or something for you guys to get those books, but right now, unfortunately, you guys do have to buy the books for the program. So, the medical terminology book, the exercises are in the book. There are some answers there, odd or even numbers. You guys don't have to worry about that. I have the answers to the odd and the even. If you want me to correct that, but if not, you guys can go ahead and check that yourself. That's fine. I just want to make sure that you do the task and the tasks are returned to me. Okay, medical terminology discussion 3, step 2. Okay, so this is the lesson 2 of the discussion 3. Lesson 3 may have 2 or 3 different discussions. I might be talking about A, and then I'll start talking about B. That's all that means. Okay, and this is just lesson 2 of the suffixes. And again, yours won't look like this. Mine just looks like this because it's is the it's the PowerPoint. So these are the roots that I was telling you about. And again, same things. This is just giving you some of the same stuff that we had. It's just, but you're looking for other stuff. So it's not the exact same thing. Use your ebooks. This is just letting you know same stuff that we went over. Remember the title of your file, your chapter. And don't forget, if one of those files are empty, which they should not be, but just in case, because sometimes when you're going through that EDI electronic system, things do get lost. Everything is in PDF. You guys already know that. Okay, so good luck with that. Well, I did give you something in Excel. I think one of your parameters, in case you wanted to tweak it how you want it. I have your regular schedule. This is your regular schedule. I've already sent you. Some of you have this. But that's in PDF. You can't alter that. I did put I think it's either rubric, not the rubric. There is a rubric in there to tell you about your course. I did put a data sheet. I think the data sheet is in there. The data sheet is a blank sheet that's in there. And that's probably in your orientation. I described that. If it's not, go to YouTube. There's probably something on that data sheet in there in the orientation. I put that in there in case you wanted to tweak that and put your scores in there. The data sheet that's in there, it says, that's what it should say, data sheet. It's a sheet that has those blue lines, and it has every single course that you have to do. You can put the date that you did the course, you can put the date that you started the course, you can put your grade in the course. You can put whether me and you had a one-on-one. You can put if you need a one-on-one. So I don't have it with me, but that's in your file. It's called a data sheet. So I made that for you guys so you can use it. That's why I said make sure you go through the files. Okay, and remember, this course, it's not an ending course. I mean, you can attend as much as you want, so you feel savvy enough to take your test. I'm not going to say, when you're going to take your test. You are going to know when you take your test. When you pass all your stuff with me, I'm going to give you insight, but I'm going to make sure that you pass all those things. That coding is not easy. I mean, I got cases like this, and you can take your time in the classroom. Make sure you decipher those cases right and find those codes. When you're taking your test, you're not going to have that much time. They dropped the test down to 400. It's not 500 anymore. You don't have like 1 minute 15 seconds no more. You have a little shorter time or X Y Z. Just make sure you do it at your convenience. Not the test. I'm talking about the exercises that I'm going to give you. Okay, and yeah, we're going to do all of the exercises and the CPC. Okay. No, you're not going to look at the answers in the back. I know the answers is in the back, but we all grown folks right here. You're gonna do the testing. We're all gonna go over it. So it doesn't really matter. Even if how I used to do years ago before I took I I used to do the test and then I'd have everybody just check their own stuff and then we should just kind of go through it. We're gonna do the same thing with you guys. We're gonna do the test, we're gonna go over it, test and grade it, and then we're gonna go through it. It's not really going to be a grade that you're going to get for that because I'm not testing anybody on the CPC. Okay, the CPC you will be tested with APC. That's what counts. What counts with us is that you learn how to code, that you understand how to do the cases, that you know what the disease is, that you know what the procedure is. You are going to get a final in this classroom on coding. Yeah, that's why you have to make sure you are deciphering this right, deciphering this correctly, because you have to pass that. If you don't pass the competency for the coding, I got to put you back in there or something ain't right. Okay, is something I need to add or is something extra I need to do or more training we need to do, then that's something that I got to fix because when you go through this classroom, you should be able to pass that coding exam that I'm going to give you. Okay, you should be able to pass that coding exam that I'm going to give you. The coding exam that I'm going to give you is 150 questions. Okay, it's 150 questions. You can take it in 3 segments. Okay. So we don't have to pass this one. What does it say? The terms are useful to know because you must be able to read medical terms and the report. Yes, you guys already know that. Okay. And I always say that put these on the index cards if you need to, because the index cards, I have a bunch of them. You study by them. That's what you need to study by. You guys know I always talk about my friend. You took a test. I think I have 1,000 index cards. Okay. Add your answer. This is just adding your answer here, and I have a lot of these little pictures and things like that in here. But you guys, again, just make sure that you study your book. Make sure if you're not clear on something that you guys are calling me, because we have to get through the medical terminology. Okay, study of the shape, softening of a cartilage, tumor, bone, disease, and heart muscle. And you know what was on the test one time. They said, what is the smallest part of the body? Make sure you watch that between that living cell and that eyeball. Okay, we're gonna go over that. I mean, we should have a debate about that, but come on now, we know what the answer is. But do you? Who knows what that answer is? Okay. Anybody else? I ain't saying it's right or wrong. I'm just asking. That's something that we're gonna go through. So if you can be right or wrong. I'm not. Okay. 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 Nobody can see your answers. Only I can see them anyway. Okay. That's how I have the Zoom. So don't worry about that. No, y'all are muted because you can't have all y'all talking at one time. I can't hear myself. Okay. 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 Good. 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 Very good. So, again, these are slides, directors, ophthalmology, just make sure you spell these things right. And you've got to pick the right word, then you got to put the meaning. Okay, so that's why that's like that. And yeah, it's going to be the same way in your book. Additional services that terminology lesson 6. Okay, that's just a lesson 6. That's all. This is just another one of your lessons. I just put it in here. Okay, language and medicine book. Okay, chapter 6 for the study of the digestive system term. Ooh, the digestive system is something. Wait till you see those pictures. There's something else. And you know what? I don't know. I say that the digestive system is one of my best ones. I like the digestive system study, whether it's coding or step by step or whatever. Digestive system, and I like cardiology. Cardiology. Cardiology is something, boy. You guys wait till we get ready to go through cardiology. And on your test, sometimes they have questions that tell you, you need to describe something in regards to cardiology. You know what I'm saying? It's the veins and arteries, which one's clean air, which one lets out the dirty air. And you know what? YouTube. YouTube is like a mini university. Anything you guys need to know, type it in on YouTube. I think I did put that part YouTube in your program. I'm telling you, that guy had a YouTube on cardiology, the heart, the function. It was amazing. You guys can see how I am with cardiology. I love cardiology. Okay, so again, give the accent to symbol. This is similar to what you guys were doing. This is the different chapter, but remember, most of what you're going to be seeing, it's the same spelling. It will be the same. It's just a different category. Okay. No, this is not part of that. I just put that there. Okay, this is just design. Okay. So again, lesson 7 is urinary, the urinary system. You see. And I'm just dropping things in here that you will be doing. Okay, give the accent to symbol. See, most of the chapters have the same philosophy as the other chapters. You just have different words. Okay. 9 is male genital. You see how many stuff we go through? We're going to go through all of these things. Well, you are going to read every single one of them because that's what we have to go through. I don't know why this is like this. If I can get through a full slide and not see an error, it'd be a miracle. Trust me. But again, this is lesson 9, male genital, and that's a part of your test. You will go through your step-by-step book is your SBS book, and that's one of your coding books. Those of you who are new to coding, that probably is one of you probably do a couple of chapters in there because that's how I'm going to teach you how to do coding through your step-by-step book. Okay, so that's first and foremost. You've got to go through the step-by-step book before you even get to the CPC course. The CPC courses are down the line. That's why I said those of you who are doing medical billing, you guys, you will be doing coding as well. The medical billing book, chapter 5, like I said that in another chapter actually has some of the coding in there. So just make sure that you are abreast on your medical terminology before you start diving into that, okay? But remember, you guys have all of the files already for medical terminology course. The files is there already. And I keep a record of the files that you are getting. So the courses that you're getting, I have a record of them. Some of you have all of your courses at one time. And then you have some that only do that are only doing medical billing. Okay. Those of you who only do medical billing, you still have those courses for ICD-10 and CPT. That is what you're going to learn. That is what you're going to learn those. The other core courses are you're going to see. They say CPC certification or something like that. The courses that you will get will be the first 1, 2, 3, 4. The core courses you will not get. The medical billing people, you get the medical billing, medical terminology, ICD-10, and CPT. That's it. The rest of the courses are for the coding students. So you guys, your course is pretty quick. Just make sure you complete what you need to complete and you get those tests back to me. Okay, lesson 8, discussion 1. I don't know what else to do. Let's get rid of that. Okay, begin reading chapter 8, and that's everything. This is female reproductive system. Begin reading chapter 8. There it is, female reproductive system. Same thing, and you gotta know. This is gonna help you guys on your tests, because on your CPC, you must, like I told you before, I don't care how much times I repeat this, you guys have to do the medical terminology. You're gonna get tired of it in Fridays. We talk about female, so you know what that is, and that's what I love. We do female, especially when we get to those cases. You're gonna know. You guys are gonna love those chapters. But again, you got to know the medical terminology. There's no way you could get through the test. You have to know medical terminology. Okay. So, the course is generally, 20 weeks, 25 weeks. Some people take 30 weeks. It's a 5-month course, 4.5 months, 5 month course. You'll get a completion certificate at the end of this course. But the goal is to get you to be certified. You're a CPC, that is the goal. I'm now incorporating the CPB into this course. So some of you just joined for medical billing. Medical billing was inside introduction with the CPC, but you still get the full course of medical billing. I used to just do a little bit of an intro in the medical billing, but now I'm bringing into the full course of the CPB on the medical billing, because some of you don't want to go further than just doing the medical billing. You still can get a job in there, because when you get ready to get a job in medical billing, they're gonna give you a test anyway. I gave you guys the answers for most of the, you know, stuff that I asked. When I'm hiring somebody as a revenue cycle director, I always ask certain questions, and that's across the board. So that's a plus for you guys. I want a revenue codes, different things, claim types, stuff like that. ICFAs, UBs, I put that stuff in there for you guys. So those of you who are taking medical billing, who are not going for the CPB, don't kill yourself. You'll be fine. You go in there, you go for that interview, you got your certificate down there, you went to Sapphire Physician Pony, online Sapphire Physician Pony School, put it on there. Okay, put your certificate with your stuff. Okay, you'll get the job. You want a CPB, that's fine, because you can recruit your own doctors. You can do what you want to do as far as your own business. Okay, so these slides are done. In closing and remarks, I don't know why I have that there. This is what should be here. Okay, I always put the email at the end. I always put my contact information at the end. Good luck. The chat is over. So, you guys call me. Let me know what you need. Let me know what we need to talk about in the classroom. You will be able to get the chats even if you cannot get on them. The chats again on Wednesday and Saturday. Wednesday, there will be a chat on Saturday. Okay, there'll be a chat on Saturday. Remember, Wednesdays is medical billing and medical terminology. Okay, so if you can't get in on it, just let me know. So I'm going to finish this chat, and then remember, there's going to be another chat for the new schedule. Okay, that new schedule, the new term starts September 3rd, but some of you are already in the classroom. That's fine. Just go ahead and get your book so you can do what you need to do. Okay, so again, contact me for any questions. This is Miss Lambert. Okay, I'm going to sign off out of here. I'm just going to go ahead and cut this Zoom down so that I'm going to stop the share right now. So you guys can ask me any kind of questions that you want to, especially as far as the class itself is concerned. I have a couple of you who are new students and have never done, medical billing before or coding before. This is your introduction. This is your introduction level right here. We do have the medical billing and coding Q&A book on Amazon. Just type that in, medical billing and coding Q&A. The book will pop up. That book is also in Kindle ebook. You guys can also get it that way. You can also get the series, the beginning series. I think I have the beginning series 1 In a couple of weeks, I'm going to post the rest of those series. I don't know. I might do 6 at a time and then I'll post more. If you guys know anybody who's interested in medical billing and they're just not sure, they can get that book and check it out. Though. I have a lot of stuff inside that book. But just, ask the questions you want. Um, okay, what's the question? Okay, okay. So, yeah, so yeah, I have some people that run through this test in 10 weeks. Yeah, I do. But those are people who are already doing coding. Those girls just need brush up. And some, when you take your coding test, they have a specialty test that you can take. And then they have, the CPC that you're taking all the tests. So some people come in, I have somebody just for, radiology. She's just doing radiology. That's like 2, 3 weeks for we just need that, get that retained back in there. So, some people do pass it. Was just doing 3 or 4 weeks here, but they just need like a brush up. But you guys that are coming in new, you still might need that full 20 weeks. If you guys look throughout the syllabus and XYZ, I always kind of vary with the weeks because I have different students that do different things, but the general is I want you to stay in the course for the full 20 weeks at least. Um, the full 20 weeks will give you insight on what's going on in the schedule. Some of you who are working and the schedule is kind of funky for you guys, work at your own pace. Just make sure you hand me your homework when it is due. Your homework is due on a Sunday. Okay, I want to see the homework in on time because I'm on a schedule with that. I have other things that I have to do beyond that, but I make that time to make sure I get that back for you guys. So again, you have Monday for medical terminology. I'm giving you an example. That's not what's on the schedule. It might be different. Monday for this, medical terminology for that. Just stay on track. Just stay on track. Um, the schedule? No, you should have this. You have the schedule. If you don't, let me know. Oh, you talking about the data sheet? Yeah, that's not the schedule. This is the schedule. Okay. So you're billing and medical terminology Monday. And then you got the step by step that's stolen money. That's for the new students. That's coming in. Are you a new student? You've been here. I thought you've been here for a minute, so you know already. You got the schedule. You must. What do you have? No schedule or something? You started the second section. Okay. All right. So I'll send you this new one. That's fine because your session is about to be over. Yeah, and that's fine. You can no, absolutely not. Stay in the course. If you don't feel like it, if you're at the end of your course, I'm sure pretty sure I've graded everything for you. Um, text me, let me know when you want to call me because I'll send you this one. If you're gonna stick with us and you're gonna stay in for and you want to do it again, okay. No, that's the purpose of this course. You guys can take this course 25 times, will make a difference, just as long as you pay first time, you good. Okay. No, because I'm not gonna tell you when you're ready to take the test. I'm pretty sure you passed everything, but if you don't feel confident enough to schedule, then don't schedule. Don't schedule. I don't recommend the scheduling. Because now if I schedule for you and you don't show up, we're gonna have a problem. You're gonna lose that money. So you have to be careful. You have to be careful. If I put a schedule in for you and then you don't tell me to cancel or change it, we have a problem. You're paying for that. So no, of course not. Even if you did pass and you don't feel comfortable enough to take the test, then no, you can go further. Okay, so we can talk later. Let me know what type of scores that you got. And if you got like 70s across the board, not saying that that's not good, but I like 85s and better. 85 to me is a little bit more confident 80. So we'll talk about it. You know, if you don't feel comfortable enough to do it, you know, if it's medical terminology or something, or just tell me what you're not good with, because I don't know. I remember some of your scores look pretty good. All right, so okay, we're sitting here. She's just, let's go. Let's end this. Um, you guys have a wonderful evening, and make sure that you get at Miss Lambert. Don't forget, go on that BPTU. You guys can join that BPTU. That's a group that we're starting. And always, you know, remember, Black Phoenix is who we are. You know, this is Black Phoenix Team Us. Okay. This is Step 5 Physician Coding School. Make sure you guys holler at me when you have a question or anything. I'm going to send the teams out. Some of you who did not get in on the chat. Okay. Bye bye. I will see you next time.